For almost 25 years, Intercept has been providing therapeutic services in a group home setting. And I feel strongly that we have maintained that mission of making a lasting positive impact.
Clients that come into Intercepts Community Homes vary. They come from all different backgrounds. We have kids that have just come into care abruptly. We have kids that have been stepped down from a higher level of care. We have kiddos that have come in from a TFC that may be disrupted because they weren't doing so well there.
The majority of them come from therapeutic foster care programs, and or they are being removed from their homes for various reasons. The other population is stepping down from level C residential locked programs.
Some of them are parental placements, so they come to us with a wide range of reasons.
It is important for us to be trauma-informed, to build open and trusting relationships, not only with providers, but in your social networks, with everybody that you're going to associate with in your community. And it also helps you build rapport within yourself to be able to feel like that you have accomplished something as a youth acclimating back into the community.
The ACE program it stands for Action Changes Everything. It's a way for the children to take control of their own treatment and to make decisions and understand that the repercussions of their decisions can move them forward.
Positive-based behavioral management program that really focuses on children earning credits for doing the right thing, for making the right decision.
And motivation is really the key to the program. Really, it's based upon money, just like everything else in life. It allows these children to gain and be motivated towards achieving their goals while also obtaining what they want.
With the credits that they earn throughout the program, they're able to make purchases of their choice. We also have a credit store.
Resident Advisory Board was developed as we were developing the ACE program because we wanted the children to have some say into what was going on in their world.
And they're able to discuss any desires that they have for their personal homes or any complaints they may have or ways that they may feel we could benefit or that they could benefit from the program changing. So they can give their suggestions. It gives them a sense of input and that they have a voice in the program. CPS, collaborative problem solving, is a way for the residents to work through any issues they're experiencing.
Rather than telling the kid what the solution is, we allow the child to develop the solution themselves. And even though we may know what the best solution is, they'll still come up with various solutions, and that's the learning process. That's where they're developing the skill to be able to solve their own problems.
Everyone should have family. And so we created the Family Engagement Specialist.
The Family Engagement Specialist in each home is tasked with making sure that children have contact with their families. Family is very important, especially for kids who are in a placement.
The purpose of this is recognizing that while we can treat the individual here, if we're not working on the family, we're returning them basically to the same environment.
Parents should expect that this is a step-down program, and moving forward, they are reacclimating to the community. So they are building trusting relationships with not just staff, they're doing family reunification, and this is a time for them to reacclimate back to the community and bond more with their family in order to move to the next step.
Intercept is really proud to be able to offer licensed clinicians to truly meet the needs of children and families, and to have that level of expertise immediately available to those children on a full-time basis. You won't find that anywhere else.
They're taught to recognize that trauma is based basically in the amygdala. That's the center part of the brain, and it gets imprinted there. That training is actually incorporated with the Yukaru training as well.
They are able to assist, they are able to de-escalate, they are able to be a support and encouragement for all our youth.
One of the great things about the group home level of care is that it's in the community. It's in a neighborhood. All of our homes are in neighborhoods, and it feels like a home.
They can participate in after-school activities and programs. They go to public schools most of the time. They go on community outings. I want our clients to feel as close to being at home without being at home. We want them to feel like they belong in a community.
Normalcy is important so youth can understand that although you've had a challenging time in your life, there's always a light at the end of the tunnel.
Our children's program is truly unique in that it actually incorporates a day-to-day assessment of how you're doing. Basically, we use a red light, green light, yellow light system and they strive really hard to stay on that green light. They get prizes and they get toys and they get fun Fridays.
When the kids graduate from Intercept, the goal is for them to have the skills that they need to be successful out in the community and also in their home.
I like to be a support and be guidance to them to say, you can do it.
They need a voice and they need someone to help them get through probably one of the toughest times that they're going to have in their life.
I want our children to know that they deserve more, and they're going to receive that here.